Hi, I'm Michelle Risser, and I'm a licensed therapist. In this video, we'll go over the definition of harm OCD, common symptoms of harm OCD, signs of harm OCD, and harm OCD treatment. What is harm OCD? Harm OCD is a subtype of OCD that's marked by intrusive, violent, or aggressive thoughts towards others. This type of OCD can be distressing to manage, as it can feel challenging to deal with thoughts about harming someone you love. It also increases risk for self-harm and suicide in order to stop the intrusive thought. Symptoms of harm OCD. Symptoms of harm OCD overlap with some symptoms of traditional OCD. The symptoms often deal with obsessive thinking and/or engaging in compulsive behavior to reduce the anxiety associated with thoughts of harming someone. Harm OCD obsessions can include intrusive thoughts like inflicting harm or pain on someone you love, having aggressive or violent images in your mind, or thinking that you're responsible for any pain that others may face. Harm OCD compulsions can include thoughts and behaviors like seeking reassurance, a mental review, rituals or avoidance, hiding knives in the kitchen or other items which might be used as a weapon, avoiding watching violent movies, excessive confessions and prayer. What are some signs of harm OCD? Harm OCD can occur at any age, and the intrusive thoughts can be very disturbing. For example, someone may fear driving into a tree, stabbing their boss, or dropping their baby. In children, harm OCD might present as intrusive what-if type scenarios like, what if I accidentally cut myself with a knife? Or what if I hurt or kill my parents? The thoughts are upsetting because the individual doesn't want to engage in them. Adults tend to engage in compulsive reassurance or checking behaviors. How to know if you have harm OCD. It can be hard to know if you have harm OCD or whether you're experiencing another form of anxiety or negative thoughts related to another issue altogether. If you find yourself worrying about someone else being hurt or hurting someone else, maybe it's harm OCD or another related issue, but talking to a therapist can help. Let's go over treatment options for harm OCD. Harm OCD should be treated by a therapist who specializes in OCD. Medication can also be a helpful tool in combination with therapy. There are 3 specific techniques that are commonly used to manage harm OCD and traditional OCD. These are exposure and response prevention, or ERP. ERP is the gold standard treatment for OCD. In ERP therapy for OCD, clients are exposed over time to desensitize them to anxiety-provoking stimuli. Mindfulness-based CBT. Mindfulness-based CBT is designed to teach an observational versus judgmental stance regarding thoughts, feelings, urges, and physical sensations. Cognitive restructuring. People with harm OCD may struggle with cognitive distortions, including all or nothing thinking, catastrophizing, or perfectionism. Cognitive restructuring helps identify and challenge those negative thoughts. Medication. In some cases, OCD medication may be recommended in addition to therapy. The therapist will likely refer you to a psychiatrist or a psychiatric nurse practitioner who can prescribe the appropriate type and dose. If you'd like to learn more about medication for OCD, we linked a video on medication in the description below. Final thought. Harm OCD is a subset of OCD and should be diagnosed by a licensed mental health professional. Your primary care physician may have a list of therapists and psychiatrists in your area that specialize in OCD. You could also use an online therapist directory that makes it easy to look up specific criteria for a therapist. We've linked some valuable resources in the description below to help you find a therapist, psychiatrist, and other helpful tools.